Now, want to actually look at some one or two things that you consider, okay, when you are dealing with people of different ages in radiography. So, if I'm dealing with a child in radiography, I consider this. If I'm dealing with elderly people in radiography, I consider this. If I'm dealing with adults in radiography, I consider this. Okay, adolescents too. So age specific competence just how to do it. You are trying to use that imaging procedure as related to the age of the person. You are trying to communicate in a particular way as related to the age of the patient, and generally the patient care is related to the age of the patient. Okay, so from neonates and infants, you should consider that their skin is very still soft, their body temperatures, the regulation is tightly, they could be irritated, inabilities to communicate, so you have to act on their behalf. So keep the room warm. Use parents for immobilization, so you involve their parents, so they are always seeing their parents, they are not seeing a totally strange face. So collimate tightly and shield both the patient and the parents. So never leave the infant unattended to. Then for children that are between the age 3 to 12, so they are always afraid of environments that are unfamiliar. So you have to make it, look cool and interesting for them. They have limited understanding, so you try to explain to the best of their knowledge, either to them or their parents. Then they are also highly sensitive to radiation. Of course, that's a growth period, so you have to help the young person and make sure that other things are not out of place. So techniques: use all those simple language and reassurance. Then allow parental presence when possible. Deploy distraction techniques, okay, all those toys and the rest of it. Then also adjust exposure factors to minimize repeats. So safety is most of the times the devices to keep them in one place is what is very important. Then for adolescents, they have desire for independence, body imaging concerns. They're just getting into seeing hair on their private parts, so they could be embarrassed. So you have to respect them, you have to explain very carefully, and you have to encourage them to ask you questions in any place that they're actually confused. Then for adults, they have a lot of conditions, so you always explain everything you are doing to them, and you have to respect it when they say no, or when they request for a particular thing to be done. Okay, so older people, they speak slowly, and you speak slowly. You have to explain everything very carefully. You provide physical support during positioning. You use padding and gentle handling to prevent injuries. Then you also allow extra time for cooperation and also movement.